Yes, the biggest one is nausea. A lot of our patients complain about the nausea, and it's usually dose dependent. So it's usually when we start the medication and when we ramp up the medication, that's when you experience the most nausea. And a lot of times it dissipates. Another one we see is diarrhea, constipation, abdominal pain, headaches, fatigue, a lump in your throat or your neck area, you're having trouble swallowing, persistent hoarseness. But more than that, we also worry about the bigger complications, which are small bowel obstruction. So that has to do with, the slowing of the gastric emptying, because as, your food becomes more sluggish, it can get stuck in the bowel. Another thing we worry about is, the thyroid cancer, which is why it is a, absolute contraindication for the medication. And because you can get dehydrated on the medication, it can sometimes lead to some kidney failure. So that is something we always monitor for as well.
So the importance is basically that you have to be very closely talking to your doctor about all of this. My question is for people who aren't going with a doctor, who can just buy these drugs off the market, and when they hear things like, "Oh, I'm going to lose more weight with this drug versus that drug," what should they be looking out for?
That's a great question because it is becoming like the wild, wild west out there. And I think that is, there are a few questions you need to keep in mind. What are you taking the medication for? What condition, diagnosis, or health goal are you taking the medication for? Do you understand the side effect profile? Are you understanding that, depending on the reason you're taking it for, that this could be a lifelong situation, or are you just taking it to lose a few pounds? Do not self-diagnose and do not self-administer watching videos online or talking to friends about the dosages.
One of the people who messaged me, this registered dietitian, she said that she's noticed this weight loss is so rapid sometimes that people are losing muscle as well, which is, if they gain that back, that's not going to be cool, obviously, because their body composition is changing.
So yes, it is definitely a fact when you are losing, weight by any means, you're going to lose fat and muscle. The way that we counsel our patients before they start this medication, they need to eat a high protein diet. But more importantly than just the diet is strength or resistance training. The reason behind muscle is because it's a fat burning organ. It's literally helping you control your blood glucose levels. So the goal for my patients is to get them to strength train, eat a high protein diet to mitigate some of that effect of the muscle loss, as well as to create a lifestyle that when they get off the medication, they're already building these healthy habits to keep that weight off.